Okay, we're going to talk about how to protect your kidneys. Lots of people are in mild or severe kidney failure. I see mild kidney failure patients every single day. So you want to know how to protect your kidneys. The first question you should always ask about an organ system is, what does it do? Okay, I had this one kidney failure patient recently, and I said, what do kidneys do? He looked at me like I was crazy. No, that's the first question you should ask. You know, people sometimes think when you talk simple, you're being stupid. No, it's a sign of being smart. What does a kidney do? A kidney excretes nitrogen. Where does nitrogen come from? Nitrogen comes from protein. There is no nitrogen in carbohydrates. There is no nitrogen in fats. So the work of the kidney is primarily to excrete nitrogen. Therefore, if you want to increase the lifespan of your kidneys, you should reduce your intake of protein. The other thing the kidneys do is they balance blood pH. Therefore, to decrease the workload of your kidneys, you should also decrease eating things that make you acidic. All right, what else to know here? Plants are primarily carbohydrate plus fiber plus potassium. I remember P for plant, P for potassium. Potassium is usually a good thing. Potassium has an effect as a vasodilator, so it lowers blood pressure. You want that. The only exception would be when a person has very severe kidney failure, then they might have difficulty excreting potassium, so they would have to be careful about that. Most people are in mild kidney failure. If a person has moderate or severe kidney failure, then it's especially important that their kidney failure be managed by a kidney doctor, a nephrologist. But tons of people are walking around in mild kidney failure. These are the stages of kidney failure. They're called the chronic kidney disease stages, and they're based on GFR, which is glomerular filtration rate. So you can see the stage 1 written a couple different ways sometimes, but the basic point of it is the amount of glomerular filtration rate you're able to make progressively decreases. When you get down below 15 cc's, then those patients typically need to be on dialysis. You don't want to end up on dialysis if you can at all avoid it. Dialysis is not a fun thing. It's like 5-hour sessions 3 times a week, and the patients feel real lousy quite often for the whole rest of the day. So you're basically losing about half your life there, at least 3 days out of every week where you don't feel so good. So you want to do what you can to avoid it. And if you do these things, you could really decrease the likelihood of ending up in kidney failure. I recommend you look up Kempner. William Kempner was a guy who put a bunch of kidney failure patients on a rice diet, and he had some very good results. All right, what's some other things here to pay attention to? What is meat? Meat is protein, fat, and it's about a 50-50 ratio of protein and fat. Animal protein in particular, it is quite different than plant protein. A lot of amino acids in the form of methionine and cysteine, and those are sulfur-containing amino acids. As part of their metabolism, the sulfur gets made into sulfuric acid, which causes a metabolic acidosis. Remember, the kidney's job is to balance the blood pH. So calcium is taken from bones and to some extent from muscle as well to buffer the pH, like calcium carbonate. And the gist of it is that calcium is then excreted by the kidneys. When you excrete calcium in your kidneys, though, think about it, that's not a good thing. Number one, you're peeing out your bones, okay? So it causes osteoporosis. Who gets osteoporosis? Little old ladies who drink milk. Vegetarian populations have less osteoporosis. The calcium then can precipitate within the kidney tubules, and it obstructs those tubules, so it pushes those kidneys towards kidney failure. And then when there's large precipitates of calcium, it'll form kidney stones. And kidney stones are no fun. You know, my father had a kidney stone one time. He said it's like being kicked by a horse. And then for them to be removed. The device to remove a kidney stone is bigger than this pencil thing. It's like the size of your thumb. You can do a percutaneous nephrolithotomy through the back. You can come up from below with a cystoscope, and they can fish it out, so to speak, or they can do lithotripsy. The bottom line, it's no fun having kidney stones. And once you got them once, you're at very high risk to have repeat kidney stones. A typical kidney stone patient will have multiple kidney stones. So you just don't want to end up there. And what do? Minimize your intake of animal protein is your first step. All right, what else to know? Well, basically, one thing about kidney failure is, you know, somebody donates a kidney for transplant, they'll still have normal kidney function. So a lot of people are walking around with creatinines. It's another measurement of kidney failure of 1.5. That would be, you would call it mild kidney failure. But the point is, they've already lost 60% of their kidney function. And what I'm trying to say is, once a person is detected as having kidney failure, it's actually not that far to go, a hop, skip, and a jump before they're on dialysis and screwed, all right? And so what I'm trying to say is, when you get your kidney lab results, be mindful and do what you can to avoid having them get worse, because a lot of people are in mild kidney failure and they could prevent ever going into worsening kidney failure, because you want to live a long, healthy life. You don't want to be really sick. And these kidney failure patients, they tend to, once you can't filter your blood effectively, your kidneys aren't working, they develop all kinds of other illnesses and they suffer a lot. It's really terrible. You don't want that. All right, what can you do? Avoid animal protein in particular. Some plant foods too have a lot of protein, especially beans, and I'd be kind of minimal on the beans. There was one book. I had a book here I think you might like. This guy's not a doctor, but I think he wrote a pretty good book. He's a kidney failure patient. His name's Lee Hull, Stopping Kidney Disease. A little bit obsessive compulsive. Look how long this book is. It could have been, you know, fourth that long. But it's a good book, and it's written by a guy who can relate to all the issues of a kidney failure patient. So definitely, you know, check with your kidney doctor if you're getting in these worse levels, but be aware that you should educate yourself. Avoid sodium. Sodium is a vasoconstrictor. If you constrict the arteries to your kidney, it makes it harder to do its job, and the sodium will cause high blood pressure. We'll talk about sodium in another lecture, but I'm just telling you, you want to minimize your intake of sodium. The Yanomamo in South America, their sodium intake's about 200 milligrams a day. We're made to probably eat about anywhere from 150 to 500 milligrams a day. Typical Americans eating, they say 7,000. I don't believe it. I believe it's probably more like around 10,000. All it takes is one box of cereal. You could be at 3,000. Then you go for a fast food meal. Most sodium comes from processed food. It vasoconstricts and it worsens your kidney function. Avoid it. Next thing is avoid fructose. Fructose is a screw job on your kidneys in multiple ways. Number one, fructose causes increased absorption of sodium from your intestinal tract. Number two, it causes increased resorption of sodium from your kidneys, leading to increased blood volume, leading to hypertension. Hypertension causes atherosclerosis. Atherosclerosis in the renal arteries causes diminished renal function over time. So it's bad like that. Fructose is also bad because it's like saturated fat in meat. It largely gets made into saturated fat within the liver. Alcohol does about the same thing. And then increased saturated fat is going to cause rouleau formation, sticking together your red blood cells. It's going to cause decreased RBC, red blood cell deformability, because of the saturated fat accumulating in the plasma cell membranes. They interdigitate. Sat fat has no double bonds, and it just interdigitates in the plasma cell membrane with the phospholipid bilayer. And what does that do? It makes your red blood cells stiff. When they're stiff, it's harder to push them through capillaries. Blood pressure goes up. Hypertension causes atherosclerosis. So you get yourself into this negative cycle of sickness. And how do you get out of that cycle? Well, try to get out of it as fast as you can. Because the longer this continues, these things like hypertension, diabetes, the more it eventually becomes irreversible because there's so much tissue damage. All right, so avoid fructose, avoid meat, avoid sodium, and avoid caffeine, because caffeine causes hypertension, increases cortisol. Cortisol has some mineralocorticoid activity, meaning that it causes some increased reabsorption of sodium and volume expansion, increasing the amount of fluid you have in your blood, raising your blood pressure. So anyways, the main point is minimize your intake of animal protein to help increase the lifespan and function in your kidneys.